Hi, I'm Caitlin Boyer. So the patient, I started my clinicals 2 weeks ago at the University of Missouri Inpatient Psych at MUPC. Very interesting, learned a lot in the very first day. The patient I chose to write about in my psychiatric assessment was a 30-year-old female. She had a history of manic episodes with psychosis. She was a veterinarian and she was living with her long-term boyfriend at the time of her first manic episode about 5-ish years ago. And her episodes with psychosis caused her to lose her job. She moved back home with her father. She had been treated, but on and off treatment. Were unknown the last time that she was taking her medications, but she had a recent episode where she went on a road trip to Oklahoma, ended up getting lost. She felt like the radio was talking to her. She wasn't seeing reality as it was. Her dad had to get law enforcement involved to find her, and they found her actually in Kansas. So her dad went and picked her up. She was found a couple miles away from her car, and they were actually, she was at a Walmart, and they actually had called police officers about her, and she was going to be transferred to be admitted to a psychiatric unit there where she was treated. Her father went and picked her up, and she had came home. And then a few weeks later, she ended up in the Mizzou Psychiatric Center with similar symptoms. The radio was talking to her. She also had said, had some delusions about her bones not being her own bones, and they had been replaced, and she wasn't able to control her own bones. So pretty significant delusions and hallucinations. She was actually contesting her admission to the inpatient psychiatric unit. We did end up going to a court meeting while I was there to testify why she needed to be there. She ultimately did waive her rights, but that was very, very interesting to see all of that and video in with the court and talk to her, and kind of got the whole a bunch of experience that day. So they did prescribe her risperidone, which she had been on in the past, or Risperdal. Risperdal is approved for schizophrenia, bipolar, acute and manic mixed episodes, as well as irritability associated with autism. It can be an adjunct for untreated depression with anxiety, and then also, it is an atypical antipsychotic. It is metabolized by the CYP2D6. Risperidone is subject to interactions with medications that act on CYP2D6, so you have to be aware of increased or decreased levels within the blood, depending on what other medication she's on, and then as well as risperidone affecting other medications. So the starting dose is typically 1 milligram twice a day, which is what she was on, and then it can go up to 3 milligrams twice daily. Risperidone works on the dopamine D2 receptors as well as serotonin. It reduces psychotic symptoms with mood stabilization, in turn, hopefully, with schizophrenic patients, reducing the negative symptoms as well. So the plan with this patient was to get benefit from the oral dose of risperidone and then transition into Invega, or the long-acting injectable of paliperidone. With paliperidone or Invega, you do not have to have the oral dose of the paliperidone because risperidol is the acting metabolite of paliperidone. So if you either have Invega PO or risperidone PO, you can be started on the Invega Sustenna long-acting injectable, which is nice. It works quickly. I asked my nurse practitioner, she had quite a few patients on risperidone in the inpatient setting. I do know that risperidone has some more significant side effects as far as metabolism and diabetes and lipids and things like that go. So I asked her why that seemed to be, it was my first day, so seemed to be her preference for those patients that we saw that day. She said it does work a bit quicker for the inpatient setting, which is beneficial for that setting. I also have done clinicals in the outpatient setting, and they've voiced that they don't prefer the risperidol because of the side effect profile. They would, depending on the patient's severity, start something different first with less side effects. So, speaking of side effects, common side effects are drowsiness, dizziness, weight gain. Like I said, the metabolism, lipids. We can also have more of the prolactin effects, especially with the males. So risperidone is a medication that helps balance the chemicals in your brain. Talking to the patient, you would tell them about wanting to improve the mood and reduce the symptoms of psychosis. You would want to tell them that you manage the symptoms of schizophrenia, or in this case, more of like probably a bipolar manic episode versus a schizophrenia diagnosis. Her history, other than that small period of time, was kind of unknown. It had been 5 years since her first episode, but there wasn't much information about those episodes that I could find. So a schizophrenia diagnosis would be more difficult. They kind of had her more of like an unspecified psychotic disorder, so very generalized diagnosis until they had more information. But anyway, back to talking to the patients, you would educate them that it's taken twice a day. Let us know if you have any side effects, and we'll follow up. She was an inpatient, so we did follow up with her later on that day, and then also the next couple days. So anyway, pretty cool medications as far as like the long-acting injectables, and in the future, hopefully they can be more cost-effective for these patients, so they're not as non-compliant like this patient. So, all right, thank you.